Hello, everyone. Welcome to another review class for our fellow practitioners. So today we shall be discussing tongues with a vertical midline crack. Okay. So let's get down to the indications. No? So if you see a red tongue and there's a vertical crack along the midline within the center of the middle third of the tongue body, this is stomach Yin deficiency. And this is especially true when you notice that the center of the tongue is dry. Okay, so how do you differentiate this from both kidney and stomach Yin deficiency? So there is a midline crack plus a tongue body color that appears very red with either peel coating or none at all. Okay, so both you will see red tongue, but I think the red in the kidney and stomach Yin deficiency is more intense. No? And um, when you have stomach deficiency, it doesn't necessarily mean that you have to really look for a peeled coating or no coating, no? What is important is you can see already the vertical crack. Of course, if you see the vertical crack, that means tuyo na siya, di ba? Oo. Otherwise, you won't be able to see it. In clinical practice, the midline crack is often seen in patients with pale or pale red swollen tongues. No? So when you have a swollen tongue body, it means dampness. And dampness can result from a weak spleen qi. No? And
Mm.
take note, spleen and stomach qi deficiency, they often appear together. Okay, in spleen Qi deficiency, this reduces the organ's function of transport. Therefore, there is lack of transport through the stomach Qi. So there will be reduced appetite, loose stools, weakness of extremities. Over long term, both spleen and stomach Qi deficiency can evolve into Yin deficiency. Now, in addition to the Qi deficiency symptoms, you will now have yin deficiency symptoms. What are they? We have epigastric pain, dry mouth and throat in the afternoon, especially intense thirst, but no desire to drink. So this is very, very pathognomonic of yin deficiency. You have the desire to drink. No, you are thirsty, but you don't have the desire to drink. This yin deficiency is reflected in the vertical crack along the midline of the tongue. So if you have a vertical crack along the midline plus normal tongue body color and shape and normal coating, you ignore this if the patient doesn't have any symptoms at all relating to the spleen and the stomach. Okay, so the patient has to be symptomatic. So if you just, especially if the tongue color, the shape is normal and the coating is normal, and then you see a vertical crack and the patient doesn't exhibit any symptoms relating to the spleen and stomach, so just ignore it. This is witnessed in adults who, in puberty or early adulthood, they experience symptoms of stomach deficiency and developing heat, but they are currently free of such symptoms um, because as their age advances, you regulate your lifestyle. No?
Mm.
Okay. A vertical um, pale or pale red tongue plus a vertical crack along the midline means there is stomach Qi deficiency. Okay? Mhm. So as long as you see the vertical crack at saka ano, I think the tongue color is normal. A little pale, stomach Qi deficiency. Now let's go to cases. Okay. We have a 37-year-old female. So since we're talking about the vertical midline crack, so be prepared to see a lot of tongues
Oh.
with a vertical midline crack, no? Symptoms niya, night sweats, so very yin deficiency, severe exhaustion, panic attacks, sore lower back. Background, severe loss of blood following. So syempre, blood loss, you also
Mm.
lose a lot of yin, di ba? So, following traumatic injury to the underside of the leg with subsequent amputation. Ikaw ba naman maputulan ng paa, no? Ang description, okay,
Right.
slightly red, slight lang, and
Mm.
swollen. Okay. Just like my patient kanina, she has this kind of tongue. Saka meron
Uh,
siya dito, the coating here is uneven. So it's very gallbladder, no?
the bladder.
Yeah. So nakalimutan ko lang i-deliver 13. Pero okay lang, babalik pa naman after 2. Okay,
Mm.
slightly red, swollen. So there is slight kidney deficiency with accumulation of dampness. Okay, thin vertical crack signifies the onset of stomach Yin deficiency. Okay. The white new thin coating in the center, this one, this is the regeneration of stomach Yin and spleen and stomach Qi. Regenerate. Okay. Okay. And then the slight depression of the root of the tongue. This is very, very significant. There is essence deficiency, slight. Bata pa siya, 37. Okay. So if possible, you should be able to see the entire tongue. You can even use a pen light using uh, ano to? There's a term for it. I forgot. Basta maputi siya. Okay, next we have a 43-year-old female. Symptoms niya, frequent mucoid stools with undigested food. Okay, tenesmus, flatulence, weight loss, no appetite, fatigue. Western diagnosis, ulcerative colitis for 10 years. So colitis, so the colon, it should be the posterior third. Kung nakikita nyo, no?
Yes.
Um, and the symptoms are very, very, um, pang ano talaga siya, pang large intestine, no? Pang colon, no?
Mm.
Um, yeah, frequent mucoid stools, undigested food, allergic rhinitis. So yeah, they're very related, di ba? Lung and large intestine. And the background, long-standing emotional problems. Andiyan na naman tayo, emotions. Okay. Um, the teeth marks are slight. So when you see teeth
Mm.
marks, we immediately think of spleen Qi
Clinch.
deficiency. With accumulation of dampness kasi medyo mataba siya, no? Deep vertical crack with small amount of yellow greasy coating. Okay? So there is damp heat here. Or, yeah. Kung medyo rough na siya, phlegm heat. So it starts as damp heat. Diba? So I hope that's okay. Let's go now to assessment. Can you help me? We have very easy assessment.
Yes, doc.
Okay, very good.
Ready.
Tip of the tongue is what area? Basic.
The heart
Yes.
area. Heart
Near near the tip of the tongue, just behind the heart area at the tip.
lung area.
Yeah. So be careful, no? Minsan kasi it's mataba. So that means you have swelling. There's inflammation. So there's a lot of phlegm there. No? Or minsan may
Or
cough.
breast.
Yeah.
Or
Especially,
is the breast
diba have you seen
problem with
patients? Yes. Nakita mo, medyo manipis siya, then may mga cracks. So that means during there was a time na bata siya, mayroon siyang lung issue. Or may na-inherit siyang lung problem sa parents or
mm,
grandparents. Okay. What are the 4 aspects of tongue diagnosis? What you're looking at on the tongue?
first the body color,
Mm,
and then the body shape, then the tongue coating, and then the moisture.
yes. So body color. Although ako, I tend to look at the coating and then look at the, okay, anyway. Hindi naman
The
kailangan in
body shape.
order. Di ba? Oo. The moisture kasi will give you a hint. Okay, bakit sa tuyo?
Mhm.
If it's tuyo, that means there's a lot of heat, di ba? or
Mm-mm.
Yin Deficiency. Tongue coating will actually tell you the strength of the like the chronicity of
Mm-mm.
the problem, di ba? Or paano nag-interiorize lahat. So, the more makapal or kung
The
wala
more.
yung coating, yeah, it's very significant. Then the body shape, no?
Mm-hmm.
Especially if it's a little bit deviated or round. Ay nako, I tell you, I have a friend na medyo manasiraan yata na ba eh. Ano, ang laki ng paa niya. Oo, next time pagbalik niya,
Oh, wow.
kukumpirm pa. Oo.
So like extremely large.
Oh yes. So it's volume. Para bang you wouldn't imagine na ganun yung
Di ba
paa.
siya na parang na-choke na or something? Or
No.
nasanay na siya?
No, but he's very asthmatic and he
Ah,
had no choice but to see me. Of course, I didn't charge him. Inano
mm-mm.
ko lang siya sa ear. He was complaining of dito sa my wrist, no? Dito sa may lung area dyan. Oh. So, syempre, inayos ko yun. So, I did
Mm-mm.
spleen 5 because spleen, at saka if you note the location, parang, di ba?
So, Doc, choppy ka.
Hala, nawawala na naman. Okay, anyway. Okay, so that's it. He was
Mm-mm,
so
choppy.
amazed because, yeah, he was so amazed because nawala yung pain until now, year long.
Mm-mm.
Kasi you need to know the location here. Eh. So, yan.
Mm-mm.
What does tongue diagnosis tell us? Like, why do we have to do tongue diagnosis?
It gives us a clear, objective, and visible markers of a person's current state of health.
Yeah, current state. But hindi lang current, no? It can also tell you what the patient has been through. So it gives us a clear, objective,
Mm.
and visible markers of the health of the patient. What does a healthy tongue look like? We've been discussing so much about pathologic tongue. Yeah, normal tongue, healthy tongue.
It's pale. Yeah. It's pale red or pink color, moist, with a thin white coat, and consistent thickness of the tongue's body.
Yeah, consistent. That means it should be thick all throughout. Pero iba kasi, may mga bukol-bukol, no? Just like my patient kanina. Yan. Siguro I'll start taking pictures of my
Mm-mm.
patient's tongue. Ano yan? Yeah.
Yes.
Now, if the tongue body color is pale, what does it immediately tell us?
A deficiency.
Yes. Could be Qi deficiency, blood
Qi,
deficiency,
yang, or blood,
or even yang. Yeah. If the tongue body color
or
is
yang.
red,
There's an indication of heat or full heat or yin deficiency.
full heat or empty heat. Okay. Tongue body color is lavender or purple.
Stagnation,
Yeah.
blood
Qi,
stasis.
Qi or blood
Qi,
stasis. If the tongue body shape is thin,
uh, depleted fluids or blood or yin deficiency.
okay. And the last one, thin body with red raw peeled coat. Ay, kailangan pala siya maging red.
Mm-mm. Yin
Kailangan,
deficient
yeah, yun.
deficiency.
Wow, thank you so much for joining. We hope you will join us again next time.
Thank you, Doc.